Hello and welcome to the Down Under Visa Philippines to Australia podcast series. I'm your host, Jeff Harvey, registered migration agent with Down Under Visa, the premier Australian migration agent in Manila, Philippines, specialising in visas for Australian Filipino couples. We hope you enjoy this podcast and hope it proves useful to you. Please feel free to share this with your partner and with any of your interested friends. Let's get started. The visa medical, what the doctors or nurses tell you. Now, if you apply for an Australian partner visa, means a spouse visa or a fiancée visa, or a New Zealand citizen's family relationship visa, or a child visa, then you need to do a visa medical examination. Now, they can also request x-ray examinations or even full medicals for tourist visas too if they think the applicant is at a risk, especially if they are elderly or they're going to attend school or a hospital, or if they will be staying longer than the standard 3 months. Now, they do all this because they don't want to bring anyone to Australia who doesn't pass the health criteria. They don't want the expense or the drain on resources to affect Australia and Australian citizens. And of more immediate concerns is they absolutely wish to keep tuberculosis, TB, out of Australia. Now, this is a nasty, debilitating lung infection which can lead to death if untreated. Now, it is endemic in the Philippines and fairly common amongst the poor folk. Now, fortunately, it responds very well to treatment. That means antibiotic treatment over a long period of time, but it always comes as a shock to those who get it. No one ever says, yes, I thought I might have had it. It's not so obvious, as everyone has a few coughs from time to time and can be a crafty little critter when it comes to x-rays too. A diagnosis of tuberculosis in the Philippines. Look, if you Google this, you can see there is a skin test that can be taken to see if the person has been exposed to TB. Now, in the Philippines, this is a totally useless test. Why? Well, because everyone here is exposed to it. So basically, everybody in the country shows up positive to it. I will show up positive to it. Everyone in my family will show up positive to it. Now, there are no blood tests. Now, the only way is looking at x-rays with an experienced eye and identifying lesions in the lungs. And this is not always easy or obvious. Now, I can share our experience here. Now, we've taken in kids who have had it over the years, and we've had them treated successfully. Now, 3 to date, and they're all in excellent health now. Now, I was with them when they were diagnosed, and I can assure you it wasn't straightforward. Now, our family doctor has maybe 30 years of experience, and in one case in particular, it took several chest x-rays from different angles before she was absolutely certain that that was what it was. Now, issue is if this happened in Australia, it's very unlikely that your GP will have ever actually come across TB, whereas this is something a doctor in the Philippines is going to come across all the time. It's just one of those things that, you know, they're used to seeing, they're used to diagnosing, and they're far more wary of that than, your local family doctor in Melbourne is going to be. Very, very bad, and it may have actually got into the bones. It can be quite bad. In some cases, you need to actually get an injection every day. But as long as somebody follows the treatment, it's almost unheard of for anybody not to get over it. So, be aware of that. And the other concern that people have is whether they're going to get a refusal because of this. I saw it happen once, but that was a case where the applicant had stopped treatment. Very strange thing to do. Stopped treatment. The hospital heard nothing from them. the hospital reported this to the department and the visa was refused. But where it's taken, where somebody has gone through all the treatment properly, I've never seen somebody actually get refused because of that. They will wait and see through the treatment, and when everything's clear, they will get back to what they're doing. So it means a delay, but look, I think you've got to look at it from this point of view. If they were here and it wasn't treated, it might have killed them. This is the point. Now, you know, one of the kids that we had here, we took her in as an orphan from Samoa, and she'd literally never been to a doctor in her life when she first came here. If we didn't take her in, she would have died. Simple as that. And that might have been what may have happened with your wife or fiancée. So at least it was identified. You get a delay, well, it's a bit worse than having a death. So keep that in mind if you're get a bit cranky about the whole thing. At least it was found out. Okay. Now, visa medicals, the actual process. Now, the visa applicant is sent off to one of the authorised clinics in Australia. Now, they're known as panel doctors for some strange reason. I guess some genius in Canberra thought that was a really logical name to call them. But anyway, that's how it works. Now, you can't see your local family doctor, sorry. They do authorise these people because they know that they are trusted and they're not open to corruption, whereas your family doctor may decide to do you a favour and let something through. So that's the reason for that. So yeah, the doctors here, they're not going to be open to corruption. However, this is still the Philippines, and staff will always be Filipino and will always want to be nice and helpful. And one of the things you discover along the way is that it's a Filipino trait. People don't want to tell you something unpleasant. They don't want to tell you something you don't want to hear, so they will tell you something that they think you will like. So I'll continue. Now, the examinations take place, and the results are sent to the medical officer of the Commonwealth, which is a fabulous title. There isn't one person sitting there who looks at them all with a glorious title of medical officer of the Commonwealth. It's actually a section of the department, and they take care of this area and whether the visa applicant meets the health criteria or not. So they are the decision makers when it comes to the health criteria. Now, based on the doctor's report, including X-ray findings, the medical officer of the Commonwealth will either give it the thumbs up or they'll give it the thumbs down. And in cases where X-ray results are not conclusive, or, well, look, it could be anything, whether it's X-ray or it could be, it could even be an issue. It could be something to do with hearing, or it could be, something to do with the child's mental development, or something along those lines, or it could be, it could be, well, anything at all, really. Well, they will send through, an instruction to down on the visa requesting further tests be done, further examination, etc. So, could be further X-rays, or it could require sputum tests to see if the TB bacteria can be cultured from the sputum. And note that the medical officer of the Commonwealth has one job to do, and that is to assess against the health criteria which is written into law. Now, they have no interest whatsoever in whether you have flights booked, or if you want to be together at Christmas or not, and you've got the Christmas tree set up and there's a present sitting under there that and you've been looking forward to this, or you've got a wedding booked or whatever. They won't be influenced at all. We can't hurry them up, so please don't ask us to. And it can be a very slow process, sorry to say. You can get situations where the results come back and, the doctor says everything's clear. There's no point contacting us and saying, the doctor said everything's great, when can we get the visa? But because it means that the embassy or the department has to wait for the medical officer of the Commonwealth to get back and say it's all fine, and they will do that in their own time. Now, if you think the department itself, the embassy, if you think they operate to their own time, well, you ain't seen nothing yet. The medical officer of the Commonwealth can be quite slow, and there is nothing we can do about it. The embassy themselves can't chase it up. So, unfortunately, that's the way it works. Now, what if the clinical staff tell you something different? This is one of those really annoying areas. Again, as I said before, Filipinos are a helpful lot, and they like telling you good and helpful things. You will discover that the more you deal with Filipinos. No one wants to be the bearer of bad news or uncertainty, so it happens that doctors and nurses will tell our clients things that are not necessarily true. Examples. They will say, your results are all good and clear. Or they'll say, your results will be sent to the embassy in a few days. Or, don't worry, you don't have TB. Now, it's not their decision to make. They're not allowed to make that decision, but they'll say it anyway because you're standing right there, and they, I suppose in some ways, I mean, I could say I could sympathise because the idea of having a waiting room full of patients who are all saying, so how was it? Is it good? Is everything fine? Is everything great? Have I got any problems? Do I have TB? What are the results? When can I get the visa? They probably find, I don't know, maybe a very large percentage of you are doing just that. So, I mean, I guess they want a peaceful life and they want to be able to go home in time. But again, not the decision to make. This is especially the case if the results are not certain, and it's even more so if it's a nurse who gives you the all clear. Now, if a doctor of 30 years plus won't give an all clear without sometimes 3 additional x-rays, in the case of TB, then I wouldn't listen to anyone giving you advice on the day. So that's the way it works, is in it goes, you sit back and wait. You don't get a copy of the test results either, by the way, so don't ask when do I get a copy of my results. You don't see it, we don't see it, even the embassy don't see it. They are in exactly the same boat as all of us. They sit back and wait until the medical officer of the Commonwealth says everything's fine and this one can go ahead. Not a problem. But look, like anything to do with visa applications, you have to take this very seriously. This is governed under law, as I said before. We had a refusal once where the applicant had stopped getting their treatment, and after I guess they probably tried to contact them, etc., and they didn't continue with the treatment. Well, they passed that information on, and the end result was that the visa application was refused. They had have continued, well, they'd be in Australia right now, but they stuffed it up well and truly. So take it seriously. There's no flexibility in things like this, and the customer is most definitely not always right. So those of you who are going through this, good luck to you. Be patient. Okay, thank you very much. Well, that brings us to the end of another episode of the Down Under Visa Philippines to Australia podcast series. Thank you very much for joining us. We hope you enjoyed, and we hope you found this useful. Australian visas from the Philippines are not easy, and the outcome matters, as you well know. Please feel free to contact us anytime if you need some further help. And we look forward to talking to you again next time. Bye-bye.